What if I told you your cholesterol problem may have already started years ago, even if your reports are normal today? And the latest 2026 guidelines are now warning. Don't wait till 40. Treatment may need to start as early as 30. This video could literally save your heart, your brain, and your life. Today we're talking about something silent, dangerous, and extremely common. Cholesterol. But not just basic information. Today I'll give you a complete updated guide based on the latest 2026 cholesterol guidelines, including what cholesterol really is, why it becomes dangerous, new guideline changes, early warning signs, tests you must do, diet plus home, remedies, medicines, prevention strategy. What is cholesterol? Cholesterol is a waxy, fat-like substance found in your body and in certain foods. It is not always harmful. In fact, your body needs cholesterol to survive. What does cholesterol do in the body? Cholesterol plays several important roles. 1. Builds cell membranes. Every cell in your body contains cholesterol. It gives structure and stability to cells. 2. Produces hormones. Cholesterol is used to make important hormones like estrogen, testosterone, cortisol. 3. Helps make vitamin D. When sunlight hits your skin, cholesterol helps produce vitamin D4. Helps in digestion. It is used to form bile acids. These help digest fats in food. So remember, cholesterol is essential. Problem starts when it becomes too much. Where does cholesterol come from? 1. Liver is main source. Your liver produces 70 to 80% of cholesterol. 2. Diet. Animal-based foods are meat, eggs, dairy, butter, ghee. Even if you eat less cholesterol, your liver can still produce it. How cholesterol travels in blood. Cholesterol cannot move alone in blood. It travels with proteins called lipoproteins. Types of lipoproteins. LDL, low-density lipoprotein. It is bad cholesterol. It carries cholesterol to tissues and its excess deposits in arteries. HDL, high-density lipoprotein. It is good cholesterol and removes extra cholesterol. Takes it back to liver for removal. VLDL. It carries triglycerides. Also contributes to plaque formation. What happens when cholesterol increases? When LDL becomes high, cholesterol starts sticking to artery walls. Forms plaque. Arteries become narrow and hard. This condition is called atherosclerosis. Why is high cholesterol dangerous? Because it leads to heart attack, blocked arteries of heart, stroke, blocked arteries of brain, peripheral artery disease, reduced blood flow to legs. Important point is, you may not feel anything until a serious event happens. Normal versus high cholesterol, LDL should be low. HDL should be high and triglycerides should be low. Modern approach is, the lower the LDL, the better for your heart. Key concept to remember is, cholesterol itself is not the enemy. Imbalance is the real problem. Think of your blood vessels like water pipes. LDL is dirt that clogs pipes. HDL is cleaner that removes dirt. If dirt increases and cleaner decreases, blockage occurs. Silent nature of cholesterol. No pain, no early symptoms. That's why it's called silent killer. Final summary is, cholesterol is essential for life. Made by liver plus food. Travels in blood via lipoproteins. High LDL is dangerous. High HDL is protective. Remember, cholesterol is your friend in balance, but a silent enemy in excess. What's new in 2026 guidelines? Now listen carefully. This is very important. Major updates is 1. Earlier treatment is now recommended. Treatment may start as early as age 30, not just after 40 anymore. Why? Because cholesterol damage starts early and builds over time. 2. Lower for longer is better. The earlier you reduce cholesterol, the longer you live. Risk is cumulative over years. 3. Stricter LDL targets. High risk, less than 70 mg/dL. Very high risk, less than 55 mg/dL. 4. New testing recommendations. Start testing early, even childhood in some cases. Repeat every 5 years or sooner. 5. Lipoprotein testing. Check at least once in life. Genetic risk factor. 6. Supplements are not recommended. Fish oil, herbal products. 6. Not reliable. Statins are still most effective. Don't wait for symptoms. Don't wait for age. Start early. Causes of high cholesterol are. Let's break it down simply. 1. Diet. It includes fried food, fast food, ghee, butter, red meat. 2. Sedentary lifestyle, no exercise, sitting all day. 3. Genetics, familial hypercholesterolemia, even young people affected. 4. Obesity. 5. Smoking. 6. Diabetes. 7. Poor sleep and stress. Reality is, most people have multiple causes combined. What happens inside your body? Let's visualize this. Cholesterol starts depositing in arteries, forms plaque. Arteries become narrow. This leads to heart attack, stroke, peripheral artery disease. Important fact, even slight reduction in LDL reduces risk significantly. Early warning signs. Here's the scary part. Most people have no symptoms, but sometimes chest pain, breathlessness, fatigue, leg pain while walking. Rare signs, yellow deposits on eyelids, tendon swelling. That's why it's called silent killer. Tests you must do. Basic lipid profile, total, cholesterol, LDL, HDL, triglycerides. Advanced tests, lipoprotein, ApoB, H's CARP, imaging, coronary calcium scan, WACTed. Guideline tip, check every 5 years minimum. How to lower cholesterol naturally. Now the part everyone wants. 1. Diet changes. Eat more fruits, vegetables, whole grains, nuts, olive oil. Avoid fried food, bakery items, sugary drinks, processed food. 2. Exercise. Minimum 30 minutes daily. Walking/jogging. 3. Weight loss. Even 5 to 10% weight loss helps. 4. Quit smoking. 5. Sleep properly. Home remedies, evidence-based. These remedies help improve cholesterol levels, but remember, they support lifestyle plus medicines, not replace them. 1. Garlic. Helps lower LDL slightly. Take 1-2 raw cloves in the morning. 2. Oats. Rich in soluble fiber, reduces cholesterol absorption. Eaten breakfast daily. 3. Green tea. Contains antioxidants. Helps improve fat metabolism, 1 to 2 cups daily. 4. Nuts walm, increase HDL, handful daily, don't over. 5. Lemon water. Supports metabolism and digestion, drink in the morning. 6. Healthy oils. Use olive oil instead of ghee, butter, helps reduce bad fats. 7. Fiber-rich diet. Fruits, vegetables, whole grains, removes excess cholesterol from body. 8. Daily walking, at least 30 minutes daily, raises good cholesterol. 9. Weight control, even small weight loss improves cholesterol. 10. Quit smoking, improves HDL levels quickly. Important reminder, these remedies work slowly, not enough for high-risk patients. If your cholesterol is high, doctors may prescribe medicines like statins, and they are life-saving. Medicines are 1. Statins, most important. First-line treatment, reduce LDL significantly. 2. Ezetimibe, add-on therapy. 3. PCSK9 inhibitors, for high-risk patients. 4. New drugs, inclisiran, bempedoic acid, new guideline trend, combination therapy early, faster LDL reduction. Who should start treatment early? According to new guidelines, you may need early treatment if age 30 plus with high LDL, diabetes, family history, smoking, high blood pressure. Even moderate risk people may need treatment at lower thresholds now. Prevention strategy is cholesterol prevention strategies, simple ends. 1. Eat a heart-healthy diet. Prefer fruits, vegetables, whole grains, beans. Use healthy fats like olive oil. Avoid fried food, fast food, bakery items, excess ghee/butter. 2. Stay physically active, at least 30 minutes daily. Jogging, jogging. Helps increase good cholesterol. 3. Maintain healthy weight. Even 5 to 10% weight loss improves cholesterol. 4. Avoid smoking. Smoking lowers good cholesterol and damages arteries. 5. Control diabetes and blood pressure. High sugar and BP worsen cholesterol-related damage. 6. Sleep and stress management. 7 to 8 hours sleep. Reduce stress, exercise, prayer, relaxation. 7. Regular testing. Lipid profile every 3 to 5 years earlier if high risk. 8. Take medicines if prescribed. Don't rely only on home remedies. Follow doctor advice strictly. Golden rule is: start early, stay consistent, and monitor regularly. Biggest mistakes people make. Biggest cholesterol mistakes. 1. I feel fine, so I must be healthy. Cholesterol is a silent problem. You can have very high levels with no symptoms at all. First sign may be a heart attack or stroke. 2. Ignoring testing. Many people never check their lipid profile. Or they check once and forget. Reality: cholesterol changes over time, needs regular monitoring. 3. Thinking I'm too young. New guidelines show cholesterol damage starts early, even in 30s. Young people are increasingly getting heart disease. 4. Relying only on home remedies, garlic, green tea, etc. help a little, but they cannot replace medicines in high-risk patients. 5. Stopping medicines on your own. Very common mistake. People stop statins when levels improve. Cholesterol rises again, risk returns. 6. Unhealthy diet despite medication. Taking medicine but still eating fried food, fast food, sugary items. This cancels the benefit of treatment. 7. Sedentary lifestyle. Sitting all day, major risk, even with normal weight. 8. Ignoring other risk factors. Diabetes, smoking, high BP, and cholesterol are very dangerous combination. Final reality check is: cholesterol damage is slow but continuous. By the time symptoms appear, damage is often severe. Smart approach is: test early, eat smart, stay active, follow medical advice. One line to remember: don't wait for symptoms, prevent the disease before it starts. Imagine this: a person in his 30s, fit, busy, no symptoms, suddenly, heart attack. Why? Cholesterol silently building for years. The new guidelines are clear: start early, treat early, live longer. If you found this video helpful, like this video, share with your family. Subscribe for more life-saving health content. Comment below: have you checked your cholesterol recently? Take care of your heart, because once it's damaged, there is no reset button.